PSA of 40, you're at very high risk. Most doctors would add in hormonal treatment. Most doctors will consider CyberKnife treatment. I assume you were treated with CyberKnife. Experimental in your case. Probably the best treatment for high-risk prostate cancer, and I think you are very high risk because of the PSA of 40, would be brachytherapy plus a form of radiation. And you may wish to consider brachytherapy and hormonal therapy in your case because of your very high PSA.
There might be a little misunderstanding. I have been treated.
I understand that. Okay. I understand that, but I'm just telling you, your treatment most likely is inadequate. So that's the problem is you need to know all the options and make the right decision to begin with. CyberKnife treatment for prostate cancer is usually considered experimental. It's probably not the best treatment for high-risk prostate cancer. With a PSA of 40, you're at very high risk for recurrence. I think there's things to do in your case. Following the PSA may not be the best thing in your case because you have such a high risk. But I'm happy to talk to you. You can call us at the office, and I'd be happy to speak to you at greater length. Our number is 212-CHOICES, 212-246-4237. And call me during the week, and I'd be happy to answer more questions for you. So thank you for calling.
Thanks for calling, Robert.
We have Dr. Eisen on the phone. Dr. Eisen is a Argentinian-born and educated radiation oncologist. He's a very equipped radiation oncologist. He trained at Columbia Medical School in radiation oncology, and he's devoted his life to taking care of the Spanish patients with cancer problems to be able to communicate with Spanish-speaking patients and offer the best possible treatment. So good morning, Dr. Eisen. Buenos dias.
Buenos dias. Good morning.
Good morning, Dr. Eisen. How are you?
Good. How are you?
Fine.
Great.
What do you have to tell our listeners today?
I would like to give a little message to the Spanish community so they will be able to get more information in their own language.
What's that message?
Okay, well, I just want to tell in Spanish that para el tratamiento del cáncer, la mayoría prefiere que sea efectivo, no invasivo, bien tolerado y ambulatorio. En Radiosurgery New York, que es la pionera en radiocirugía.
Dr. Eisen, why don't you tell us in English, because most of our listeners are...
Okay, so I want to tell them that the way that we are doing it in our center is in their own language. We go over all the situation that they have. We work on all the previous information, and we do get all the information that they need, pathology or x-rays if they cannot get it.
What kind of diseases do you treat?
Well, probably lately more and more we are moving into not only primary tumors, but also patients that they have an issue with previous treatments that they are coming to us because they have a recurrence or they are coming for a second opinion, which actually is extremely important because they have a chance to take a look at the whole situation.
So do you treat then, for example, if you have a lung cancer or liver cancer or kidney cancer, the primary or the metastasis?
Absolutely.
And what's your success rate for those?
Well, usually when we target, for example, recently on patients that they have a metastasis and we focus the radiation using radiosurgery, 5 treatments, the control of the tumor of the metastasis is close to 90%. And also the pain control, if it's in a situation that the tumor is pressing in some areas or is creating pain on the bone, it's excellent. It's the patients immediately after like a week.
That's all with that's all with radiosurgery. So it's a non-invasive method of treatment, outpatient.
Exactly, it's outpatient. That's very important because many times patients, they live with a family and they're very concerned about getting into a hospital. And I always tell them, no, you can get it outpatient. We are in the center of the island. We are in 38 and Broadway.
Which island? We're the center of Manhattan. It's the center of the world.
It's the center of the world.
So how do people find you? How can they call you day or night?
Well, definitely. They can call me 24/7.
So what's your phone number?
917-836-8105. And
What's that number? Do you have it in Spanish for your Spanish
for the Spanish community, 917, so it's 917-836-8105.
Okay, can you give it one more time before we end
Sure.
the show?
917-836-8105.
All right, thank you. So people should feel free to call you anytime. Is that fair enough to say?
Absolutely, 24/7. I do enjoy, and also they can come to our place. They can call the front desk. We will get an appointment, and we will be able to go over the whole situation.
All right, thank you very much, and have a nice weekend.
Thank you.
Thanks, Dr.
Okay,
Eisen.
bye-bye now.
Bye-bye.
So that's Dr. Eisen, who takes care of Spanish-speaking patients in their own language who have cancer. So you can feel free to call him at the number he gave you or our own office number. We also had several other interesting patients that came back. We have one patient who's about a 65-year-old man with gastric cancer. He went to a surgeon after he had bleeding and pain. He was found to have gastric cancer. His biopsy showed gastric cancer. He had attempted surgery at one of the big hospitals in Manhattan, and it was unresectable. The cancer was growing through the wall of the stomach into the adjacent tissues. And we treated this man with radiosurgery, did a course of radiosurgery, and we get a follow-up PET scan. A PET scan is an injection of radioactive material to see exactly where the cancer is.
Okay.
So initially we did a PET scan which showed the cancer growing through the wall of the stomach. We then did another PET scan after the completion of therapy, and the cancer was gone away.
Good news.
Gone away.
Good news.
So he went back to the surgeon. We sent him back to the surgeon, and the surgeon was shocked. He's about a 60-year-old surgeon, very prominent. He said never in his life had he seen a gastric cancer go away with radiation like he did with our radiosurgery.
And this was after seeing you, doctor, correct?
We treated him,
Right,
yes.
right.
I don't want to toot my own horn, but yeah, we treated him, and he had really no complications during surgery. He did great, and the follow-up PET scan showed the cancer went away. So it's really very good news for him, and I was very happy for him. But another man with a skin cancer on his cheek. He's actually a diplomat. He's an ambassador for the State Department. He's traveled around the world, and he has a keratoid canthoma of his skin, and the surgeons wanted to do radical surgery. And he came to us. He heard about non-invasive treatment, especially to try to keep his face intact.
Sure, he's probably in the light, if you will.
Right. So
often.
when you meet someone, the first thing you see is their face.
Yeah, sure.
And he didn't want to have a deformed face, so he's just started treatment yesterday, and we'll report back on him. But
keep
most
us
likely
updated on that.
Okay.
Good.
We have another interesting case, a man who has kidney cancer and metastasis to the lung and to the brain. Now, the brain we gave radiosurgery to, fractionated radiosurgery, so it's non-invasive treatment for brain metastasis. Kidney cancer was always thought to be radio-resistant, that it would resist radiation. So this man had radiosurgery for his brain metastasis. They all went away.
Wow.
Now he had the chemo Sutin for the lung metastasis.
Yep.
And the cancer grew. So it's a very nice comparison. Radiosurgery for kidney cancer went away. Sutin for kidney cancer, the cancer grew. And actually, Sutin only works for about 30% of people for about 6 months.
The more traditional approach was less effective.
The more traditional approach, chemo, didn't work. So it's just a sign for kidney cancer and other cancers. You may want to think about radiosurgery, even if the other surgery, radiation, or chemo hasn't worked. Unfortunately, the hour's almost over, so feel free to call us at our office number, which is 212-CHOICES, 212-CHOICES. We have a free booklet and DVD to send to you. Just give us your name and address. We thank you for tuning in. And again, call us at 212-CHOICES to have all your questions answered in private or in person.
Have a great day.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.